My husband and I were planning on a home birth from even before conception, and it turned out to be a fortuitous decision for a lot of reasons. The unique stress that I started to feel in terms of the initial kind of stress that I started to feel when quarantine began and social distancing began was the absorption of some of the anxiety that I thought perhaps my care team might be feeling in terms of trying to avoid getting sick, whether or not that would change the care that they provided, which it didn't at all. But this idea that somehow I would feel a lot more isolated in labor than I had anticipated. And that was really hard initially, was trying to figure out what that might look like. The biggest impacts of the pandemic on my birth experience were related to feeling socially isolated, um, questioning any anxieties that were occurring both on behalf of, on a micro level with my midwives, and then also on a macro level, understanding what that looked like in a more institutional setting. And then also thinking about what the pandemic has meant for people in their postpartum period, which is already can be a very isolating time, and can be made harder when you're being told that you actually have to socially distance yourself from other people. So those are, I would say, the main pieces, the main takeaways from my experience with regards to care and the pandemic.